Are you a nurse seeking to validate your degree, but you don't know much about the NCLEX exam, its recent changes, or how to prepare for it? The NCLEX National Council Licensure Examination is the license exam that nurses graduates must pass in order to practice legally in the United States or Canada. In 2023, the National Council of State Boards of Nursing, NCSBN, introduced changes to the NCLEX question format. Previously, these tests only include simple answer or multiple choice questions. Now, under the new format known as the Next Generation NCLEX NGN, the structure has evolved. But what exactly is the NGN and what changes were made? One of the most significant updates is the introduction of case-based or clinical scenarios designed to evaluate critical thinking skills. These scenarios simulate real-life situations nurses are likely to encounter. The exam now provides patient information such as diagnosis, physical assessments, vital signs, and even lab results. Based on this data, nurses must answer multiple questions that require both critical thinking and fundamental nursing knowledge. The exam presents 3 case studies with 6 questions each, 18 NGN-style questions in total, while the rest of the exam maintains the traditional question format. Additionally, 5 new items types have been introduced. First, extended multiple response. Second, extend, drag, and drop. Third, drop-down responses. Fourth, enhanced hotspot. And fifth, matrix grade response. Let's take a closer look at each. Extended multiple response. Similar to the traditional multiple response questions, but with more answer options. Extended drag and drop requires test takers to move options into the answer boxes. This extended format offers more choices than before. Drop down response. Options are displayed into the drop down menus, sometimes across multiple answer boxes. Enhanced hotspot. Candidates must highlight or select specified portions or text passage based on the question prompt. Matrix grade response requires choosing between options such as appropriate or inappropriate or agree or disagree within a structured grid. Let's talk about the changes in scoring. The scoring method has also been updated. The NGA now uses a partial credit system for the multiple response questions, which makes grading more flexible compared to the all or nothing approach of the previous exam. The NCLEX applies 3 scoring methods. First, 0-1 scoring. Each correct answer credited, incorrect answer simply earn no points. Second, more or less scoring. Correct answers add points, while incorrect answers subtract points. And third, the rationale scoring. 2 pair answers must both be correct to earn 1 point. If either is wrong, no credit is given. This shift aims to create a fairer and more accurate reflection of a candidate's performance. Now, let's take a quick review of the structure and timing. The NGN includes 85 to 150 questions depending on the candidate performance. If a test taker demonstrates competency by question 85, the exam may end early. However, because it uses a computerized adaptive testing CAT form, the system may continue presenting questions until it reaches 95% certainty about the candidate's ability. The total exam time allowed is 5 hours. The previous NCLEX was often perceived as extremely difficult to pass. However, the NCSBN designed this new version to better evaluate clinical judgment, patient safety, and critical thinking skills rather than rote memorization. How to prepare for the NCLEX? Proper preparation is essential. Here are 6 key strategies. First, develop critical thinking. Remember, the exam is constantly tests your ability to think like a nurse in real clinical context. Second, practice with question banks. Many platforms simulate the CAT form, helping you become familiar with the test environment. Third, review case studies. Since clinical scenarios are central to the NGN, this will strengthen your readiness. Fourth, avoid rote memorization. Focus instead on applying nursing knowledge in practical situations. Fifth, improve reading comprehensions. Some questions are designed to test how well you interpret information without being distracted by irrelevant details. Sixth, focus on weak areas. The adaptive format can detect patterns in incorrect responses and present more questions in those areas. So, reinforcing weak points is crucial. Well, if you're unsure how, when, or where to begin your preparation, consider seeking support from Enfermeras en USA, where you will find the guidance and study materials you need.